We've all been there. It's late at night, a little worry pops into your head, and suddenly you're falling down an internet rabbit hole searching for health advice. But have you ever really stopped to think about where those searches take you? Today, we're going to look at two very, very different kinds of health guides you find online.
It's such a familiar feeling, isn't it? It's late, you can't sleep, or maybe there's some nagging little symptom that's just got you worried. So you grab your phone, you type in a few words, and that one search can send you down two completely different paths for information. So on one side, you might land on a site like sleepfoundation.org. They call themselves your trusted sleep advocate. Okay. Then on the other side, you could end up at mayoclinic.org, which is known as the world's best hospital. I mean, just from those two taglines alone, you can tell we are in for a totally different experience on each site.
All right, so let's start by walking down that first path, the one that takes us right into the world of wellness products. Our guide here is going to be the Sleep Foundation.
The second you land on a site like this, bam, the focus is immediately clear. It's all about products. You're seeing best of lists for mattresses, pillows, weighted blankets, you name it. It's basically a curated shopping mall, and it's designed to give you a product-based solution for whatever's keeping you up at night.
And this isn't some small-time blog. We're talking about a pretty big operation. They've reviewed over 800 products. That tells you right away that their whole model, their whole reason for being, is built around testing and recommending stuff you can buy. What they've created for you is this really simple, really clear journey. You show up with a problem, right? Like, I want to stop snoring. They point you to a whole category of solutions, in this case, best anti-snoring mouthpieces, and then they guide you straight to a list of products you can click and buy. It's a straight line from problem to purchase. And their own tagline, it sums up their entire value proposition perfectly. The promise here isn't a medical diagnosis. Not at all. It's about consumer confidence. They're saying, hey, we had experts test these things, so you can feel good about buying them. The goal is that you'll wake up rested, thanks to your purchase. Okay, now let's hit pause and completely shift gears. We're leaving the world of wellness products and stepping into the world of clinical care, represented by the Mayo Clinic. And you can feel the entire tone change immediately. And wow, the contrast is it's night and day. We've gone from talking about mattresses and pillows to bone marrow transplants and brain tumors. Mayo Clinic isn't focused on products you can buy for a better night's sleep. It's focused on solving the absolute most complex medical challenges a person can face. And think about where their credibility comes from. It's not from product reviews. It's from their actual standing in the global medical community. Being ranked the #1 hospital in the world, well, that establishes a really deep, profound sense of authority. And here's their core mission, right here. It's all about getting the diagnosis right and finding the most effective treatment. When you're dealing with something serious, getting the right answer from the very beginning is absolutely everything. That's the promise they make. They call their approach patient-centered care. And in this world, that means the focus is squarely on the patient's condition. The whole goal is to use expert medical knowledge to diagnose and treat a disease, not to recommend something you can add to your shopping cart. So we've walked down these two very different paths. Now let's stand right here at the crossroads where they meet and put them side by side. This is how we can really understand what's going on when we search for health info online. This table just lays it all out so clearly. You've got Sleep Foundation, whose mission is to help you sleep better by selling you products. Their audience, your consumer. Then there's Mayo Clinic. Their mission is to solve serious medical challenges, and they're talking to you as a patient. That fundamental difference changes everything, from the content they create to the ultimate goal. One wants to guide a purchase. The other wants to inform a medical decision. They are playing two completely different games. If you want the simplest way to think about it, here it is. One site is all about the shopping cart. It's there to help you become a smarter, more confident shopper. The other site, it's all about the stethoscope. It's designed to help you become a more informed, more empowered patient. Now look, the point here isn't that one of these is good and the other is bad. Not at all. They are just different tools for very different jobs. If your neck hurts and you need a new pillow, a product review site is fantastic. But if you're worried about a serious medical symptom, you need a clinical resource. The real power is in knowing which tool you actually need for the task at hand. And that really leaves us with one final big question to ask yourself the next time you find yourself opening that browser late at night. When you're searching for health advice, what role are you playing in that moment? Are you a customer looking for a product to buy? Or are you a patient looking for a deeper understanding? Knowing the answer to that question is the first and most important step to finding the right information.